Hello, I'm Jen. I'm going to be your nurse practitioner for today.
Hi, nice to meet you.
Okay, so for today we're just going to do a quick exam. It's going to be your head, ears, eyes, nose, throat, and skin. I'm going to kind of start from the top, work my way down. If you have any questions along the way, please don't hesitate to ask, okay?
Okay.
So first I'm going to take a look at your hair. Your hair looks to be evenly distributed. I'm going to go ahead and just palpate your scalp, feel for any lesions, any scabs, look for any dandruff, any bumps. The occipital region seems within normal. Texture is dry, and hair is evenly distributed. Color is brown with some graying. So next I'm going to just take a look at your head, do a little inspection. Head looks to be midline, symmetrical, no tremors. The skull and scalp were symmetrical. No lesions to be noted on the face nor the scalp. Skull size is appropriate for age. Face is symmetrical. Shape is normal. No trauma noted to the head or skull. No unusual features. Pigmentation is appropriate for ethnicity. No tics or abnormal muscle movements. I'm going to go ahead and palpate your sinuses. I want you to let me know if you have any tenderness with this, okay? Any tenderness here?
No.
And what about here? Okay, good. No tenderness in the sinus areas. I'm going to have you go ahead and just move your head in a circle, and then up and down. Okay. No limits to movement in her head or neck. Next, I'm going to go ahead and move on to your eyes. So I'm going to just take a look at your eyes. I'm going to have you move your glasses for this. Okay, so I'm just going to take a look at your eyes. Scleras are white. Conjunctiva is pink. No noted abnormalities. The external eye, no discharge, no redness, no foreign objects in the eye. Irises are brown and same color bilaterally. Okay, eyebrows and eyelashes are evenly distributed. No scabbing there. So next I'm going to take a look at your pupils. I have a little measure on my paper here. And I'm just going to measure your pupil size. Go ahead and look straight ahead. Pupils appear to be about a 3 to 4. Okay, good. Okay. Now before I do this, I'm going to check your 6 cardinal vision. So I just want you to follow my finger. And I'm going to move it and just keep tracking my finger, okay? Good. Okay, and now you're going to keep following my finger. I'm going to pull my finger all the way towards your nose, and I want you to follow it with both eyes, okay? Okay, and pupils do constrict as the finger gets closer to the nose. Lacrimal gland looks to be in good condition. No excess excretion of any fluids. Next, I am going to assess for any ptosis, which is drooping of the eye, any tremors in the eye, redness, swelling, which no redness, swelling, tremors, or ptosis noted. Next, I am going to check for pupillary response. So I'm going to shine this bright eye, and while I'm looking for pupillary response, I'm also going to take a look at the sclera and the iris and look for any abnormalities there. So I'm going to shine this light into your left eye. I'm just going to look for pupillary response. The pupil does constrict in the left eye. I'm going to do the same thing in the right eye. Good pupillary restriction. And now I'm going to look for consensual pupillary response, which means I'm going to shine my light in the left eye, and the right eye pupil should restrict, which it does. I'm going to do the same thing on the right eye, and the left should constrict as well, which it does. Perfect. Okay, I'm going to have you look straight at this light with both your eyes. Okay, good. pupils constrict and converge a little bit towards the nose, which is what we're looking for. Okay, I'm also going to have you, now I'm going to have you focus on my finger, and then look at an object behind me, such as a microwave. Then look back at my finger, look at something straight behind me like the microwave.
Here's what I found.
Okay, good. Pupils restrict when looking at the closer object. Next, we are going to do a typical vision testing with the Snellen chart. This one's a little bit smaller, has me stand 6 feet away, and I'm going to have you do it without your glasses on. I'm going to hold it. I have it marked 6 feet, and you're just going to read to me the letters, okay? So which is your worst eye, left or right?
Right.
Okay, so I'm going to have you cover your left eye first, and you're going to go ahead and read to me as far down as you can go, starting at the top.
I can't see anything at the top.
You can't see this letter?
No.
Okay, let's switch eyes. Okay, now let's try with glasses on.
E L T F P H O L C F D H J B S E F T Z O C F H C F B H J L T F E H.
Okay, we're gonna. Oh, you're supposed to cover one eye.
Oh.
All right. Well, we're gonna redo and cover one eye. Okay.
Okay.
This is her left eye.
Do you want me to start at the top and go down?
Yep. Start at the top.
E L T F P H O L C F D H J B S E F T Z O C F B H J E T F. Wait, E.
If you can't read it, it's okay.
All right.
Okay. Now we're gonna do the same thing with your opposite eye.
E L T F P H O L C F D H J B S E F T Z O C F G H Z. And I can't read the bottom.
Okay.
I need new glasses.
Okay. So for your left eye, you had about 20, 25 vision. And then for your right eye, you had about 20, 30 vision. Next, I'm going to take a look at your inner eye.
Do you need this off?
Yes, please. Okay, I'm just going to rest my hand here. And have you just look straight ahead, okay? I'm going to look for your red reflex, but let me get this better in focus first. Okay, go ahead and just look straight ahead. Okay. Red reflex is present, and I'm going to go ahead and move closer, okay? Looking at the inner eye. I'm going to move my head around a little bit so that I can make sure I have visualization of everything need be. Okay. Lens is clear. There was a positive red reflex in that right eye. No lesions noted on the retina. Blood vessels are within normal range. The veins are larger than the arteries. No cotton wool spots. Disc is well approximated. And then I'm going to check your macula. I want you to look directly at the light, okay? Not quite yet. Look away. And then go ahead and look directly at the light. Okay, macula is appropriate. All right, we're going to do the same thing now on your left eye, okay? So go ahead and look straight ahead. I'm going to look for your red reflex, which is present, and now I'm going to come a bit closer so I can visualize your vasculature, your veins, and your arteries. Once again, veins are larger than the arteries. Disc is well approximated. Go ahead and look right at me. Okay. And the macula is appropriate. So next we're going to move on. I'm going to turn this off for now. Next we're going to move on to your ears. So just assessing the ears. Ears look symmetrical. No redness noted. I'm going to just go ahead and feel back here in your mastoid process. Any tenderness here? Okay. So size is appropriate on both sides. They are symmetrical. Position is appropriate. Top of the pinna is in line with the outer corner of the eye. No deformities to either ear. Already palpated your mastoid process for any tenderness, which you denied. I'm gonna take a look inside your ear, but externally there's no nodules or swelling noted. So I'm gonna go ahead and switch my top off here. I'm gonna take a look inside your ear, okay? And you wanna use the largest top that fits in the ear comfortably. So I'm gonna have you stay really still. I'm going to pull your pinna up, which you're supposed to tug on first and make sure there's no tenderness within the ear. No tenderness? Okay, so when you pull up on the pinna and there is tenderness, it can indicate redness or swelling inside the ear, which you would want to be careful with. Okay. No discharge or drainage, no redness, swelling, scant amounts of cerumen. Your tympanic membrane is gray and pearly. So I'm going to do the same thing over here on this side. I'm going to pull up on your pinna. Any tenderness? No. Okay, once again, no redness or inflammation, scant amount of cerumen. The tympanic membrane is gray and pearly. No nodules noted. Contour is appropriate. So next we're going to do some hearing tests. We're going to start with the Weber test, which I'm just going to hit my tuning fork. I'm going to put it in your skull. And I want you to tell me which ear, or if you hear them in both ears at the same time, okay? Feel the vibrations. Do you feel them in both ears? Okay, good. So that's what we want. We want to make sure there's no blockage or interruption in the vibration sensation to your ears. So next we're going to do the Rhine test. I'm going to place this, and I'm going to put the vibration behind your ear in your mastoid process, and I want you to tell me when you stop feeling or hearing the, when you stop hearing the sound, okay? So we're going to start over here with your left ear. We'll try it again. Okay, tell me when you stop hearing it. Okay. And can you still hear it here?
Yes.
Okay, good. So that's what we're looking for because air conduction and vibration is quicker, more prominent than it is by bone conduction. So you should be able to hear it longer through air conduction than you can through bone conduction. So we're going to try it again on this ear. And go ahead and tell me when you stop hearing it. And you can still hear it. Okay, perfect. Next, we're going to do the whisper test. So I'm going to have you plug your ear over here, just one ear, and then don't look at my lips, and I'm going to say a 2-syllable word, and I want you to just repeat that to me, okay?
Baseball.
Good. We're going to do the same thing on this ear.
Baseball.
Good. So no hearing problems. No hearing problems noted. So next we're going to move on to the nose. External nose looks midline. No obvious deformities to the nose. I'm going to palpate for any tenderness. I'm going to remove your glasses and just pull them up. Any tenderness here? No. Okay. No tenderness in the nose. No cartilage displacement externally. I'm going to take a look internally. Size is appropriate for face, no swelling, redness, trauma noted. No external masses can be seen. I'm going to have you clog one and blow out. Okay, we're going to do the other one. Paint and see if theirs is clear. So I'm going to take a look. I'm going to have you tilt your head back. I'm going to pull your nose back a little bit and just examine. Good. No redness or swelling internally in the nose. The walls of the intranasal membrane are pink, reddish, a little bit lighter than the oral mucosa. The cartilage looks to be aligned. No swelling of the terminates, no perforations. We already checked your frontal and maxillary sinuses, and you had no tenderness. I'm going to go ahead and look at the mouth and the throat. Lips look to be symmetrical, no cracking, no chapped lips, no ulcerations. So I'm going to go ahead and have you open your mouth. I'm going to take a look around inside your mouth a little bit. Go ahead and stick your tongue out and look at your tonsils. Okay. No missing teeth. Tonsils are 1+ and normal. Mucosa is a pinkish red color. No missing teeth, no crowns, no caps. This is where I would palpate the inner mouth if I had gloves for any masses, but I do not have gloves, so I'm not going to be doing that. No lesions. And I would also elicit a gag reflex here, but I'm not going to do that. So neck is symmetrical. It is full. She has full range of motion that we tested earlier. No webbing or masses. No skin folds present. So I'm going to go ahead and feel your trachea. Trachea is midline, no masses, any tenderness. No tenderness. Okay, I'm going to go ahead and palpate your thyroid bone from behind, or your thyroid muscle from behind. Okay, go ahead and swallow for me. Okay. It rises and then decreases with, or rises and then falls with swallowing. Thyroid was normal shape, size, no enlargement, no nodules, no tenderness. So I'm going to go ahead and go through your lymph nodes and palpate those. I want you to let me know if you have any tenderness. So I'm going to do preauricular, postauricular, occipital, submandibular, submental, anterior, posterior, sternocleidomastoid. Going to do your supraclavicular, your interclavicular. Any tenderness with any of those palpitations?
No. No.
Okay, good. Nodules are soft. They're mobile, which is normal. So now I'm going to auscultate over your temporal artery. Pulse is normal, able to auscultate. Now I'm going to have you hold your breath. I'm going to put my stethoscope, the bell of my stethoscope, over your carotid. I'm going to listen for any bruits. So go ahead and hold your breath. Go ahead and breathe. And have you hold your breath again. No bruits noted. Okay, and I'm going to go ahead and put my hands here. I'm going to test your temporal mandibular joint and see for any crepitus. Go ahead and open your mouth. Go ahead and shut it. Open one more time. Close it. No clicking or popping at the TMJ. So next I'm going to just assess your skin. Just from inspection, skin looks to be an appropriate color for ethnicity. It is uniform throughout. Doesn't appear to have any vascular issues. Skin is symmetric. Looks to be well kept. I'm going to go ahead and check your body for lesions. We have a small abrasion on the left leg. Looks to be just a small scratch. Some scattered birthmarks on her upper arms. And I would also assess her, have her undress and assess her back and her abdomen. So her abrasion is measuring about millimeters.
That's a dog scratch.
Okay, and she was scratched by a dog. It's a little bit red with some scabbing on front of or on top of it. Texture a little bit risen, a little bit rough, a little bit elevated. No exudates, and it's a straight line. No patient odors to the skin. Temperature in all extremities is equal and warm. Moisture was dry. I'm going to check your skin trigger, so I'm going to pinch up here, and this is going to tell me a little bit about your hydration status. So really, no tenting. Great elasticity, just falls back down to normal, which indicates a good hydration status. So I'm going to take a look at your nails now. Nails are well kept, no redness or swelling. They look to be symmetrical bilaterally. I'm going to check for capillary refill, which is less than 3 seconds. I just pinch down and watch for color to return. Any pain in any of your nails?
No.
Okay. No warts or cysts noted on her fingers or hands. Nail base looks to be almost exactly 180, no clubbing present. Nails are thin, smooth, no roughness. Cuticles are an appropriate white, pale color. Vasculature looks good. And then all nail integrities are kept up. And all nails are adhered to the nail bed appropriately. So that's going to complete our assessment. Do you have any questions for me?
No, thank you.
Okay, thank you so much for your time today.
Nice meeting you.
You too.